Hello, my name is Dr. Laura Hanson. I am the owner and founder of Original Development and Therapy Center. This video is part of an ongoing series. I'm reaching out to the community to tell you about our facility. Original Development works with children that are either expected to have some type of developmental delay, or maybe your child has already received a diagnosis. There are many diagnoses out there, and there are many different children. This particular video is going to give you some background into the diagnostics that we use to help your child. It will also help you understand what makes us different. One of the things that makes us different is our diagnostic tools. You see, even though there's many diagnoses out there, each child is different. And after reviewing as many cases as I've reviewed, I can tell you that there might be very similar histories and backgrounds, but the way that it is displayed in a child can be different from one child to the next. Today I would like to tell you about a diagnostic tool that we used called a Neuroinfiniti. The Neuroinfiniti measures the stress response in the body. You actually look at how the brain waves respond to typical stressors. That is what your nervous system is trying to do in all the environments that you experience each and every day. And our children are no different. The way the test begins is your child would be hooked up to some electrodes. They would go 2 in the head, 2 at the ear, some on the hand and around the waist. The child is then going to experience 4 different stressors. The first one is just how are you adapting to the test. The second one is a cognitive challenge. The third one is distracting noises. And the fourth one is biofeedback. How well do you breathe? That breathing part is most essential. There's 3 things the brain must have: glucose, oxygen, and stimulation. If we are not breathing correctly, then there's no way that we have the oxygen fuel necessary to think, to focus, to make connections, to play, to grow. During this test, the stressors are introduced into the environment, and the child literally will have a response that will be able to be measured. Behind me is an example of that chart. I'm able to look at how the brain waves responded during each of those stressors. And then we're able to see during those stressors how the brain expected or directed the body to respond. I find this particular diagnostic tool most helpful when I'm working with children. In fact, it is the first place that I begin. Children 4 years and above can sit here for a 12-minute test and respond just as you would expect them to do. In fact, I've even had a child 3.5 be able to participate in the test. So it's not a hard test, and it doesn't take a long time. But it will actually demonstrate on what's going on inside your child. Some of the most interesting cases that I have actually looked at were children that were already on prescription medications for something like anxiety. Now, while the child may demonstrate normal behavior on the outside or a behavior more fitting to a particular environment, what the test began to show was a completely different response was actually going on inside of the child's body. So these points are very important when we're trying to understand what's going on inside. In fact, I'm doing some research right now. I've taken 25 of the children that have come through the center, and we have performed the EEG evaluation during the stress response. All of these children had different diagnoses, but what was most interesting was that the one thing all these children had in common was that their brain did not engage correctly. So I've referred to that this is a stress response test. One of the things that I find we really need to define is the word stress. We immediately think of an emotional response. Stress is not just emotional. It certainly is emotional, but if you saw in our earlier video on mechanical, chemical, and emotional, stressors can be identified in each of those categories. So a mechanical stress can be an ongoing sprained ankle. A chemical stress could be food sensitivities. An emotional stress could be social withdrawal. There are many different characteristics that fit underneath each of those headings. So when we do a stress response test, we're going to introduce a stress, and then we're going to expect to see a particular outcome. So for example, while I know you can't see the details, you can at least appreciate the color bars behind you. So the really bright colors, this teal, lime green, royal blue, and pink, those identify the 4 different stressors. The light blue bar that's beside each of those is when the stress was turned off. So the color bar is stress on, the lighter bar is stress off. There is a particular pattern that should be seen when the stress comes on and when the stress comes off. There's also a particular pattern that you should see that is particular to one type of brain wave. So the theta brain wave is going to engage in a particular way, and the beta brain wave is going to engage in a completely opposite way. So this brain engagement is telling me, can you handle a stress, mechanical, chemical, or emotional? Or are you having a hard time with really making sense with that in your brain? The other valuable information that comes from this particular test shows me if the power is right. Do you have enough theta brain waves? Do you have enough beta brain waves? Then we look to see how do those stress responses play out on the rest of the body. This is where, when I was talking about a child maybe on anxiety medication, I can begin to see the medication is absolutely affecting the brainwave, but what is that doing to the rest of his body? How is it affecting heart rate variability? That is the balance between sympathetics and parasympathetics. How is it handling or affecting the heart rate, skin conduction, temperature, respiration, that's that fuel, that oxygen, and then muscle tone. This is at the heart of diagnostics at Original Development and Therapy Center. This gives us a foundation as to what's really going on inside of your child. From there, a personal program is designed for your child. Coupled with a neurological evaluation, we can determine exactly the areas that we need to target and the progression in which that your child will handle it best. There's many unique features to Original Development and Therapy Center. We invite you to a complimentary consultation either through the website originaldevelopment.org or feel free to give me a call. My number is 770-853-0945. I look forward to serving and supporting your family. Thank you.